Namaskar. I, Dr. Rahul Bansal, MBBS MD in Community Medicine, going to take up the Bookinar on this, one of the world bestseller, Beyond Relaxation Response, by a well-known author and cardiologist, Dr. Herbert Benson from Harvard Medical School. He has written the previous book, Relaxation Response, which is yet another international bestseller, where he has very thoroughly discussed how by simple steps, a person can bring physiological changes in his or her body. The blood pressure reduces, heart rate comes down, respiratory rate comes down, the alpha waves, the peaceful waves you can say, of the brain increase, oxygen consumption decreases, and he has thoroughly discussed that topic very scientifically in this relaxation response. But he still wrote the book Beyond Relaxation Response. Why? Because he has added faith factor. What he found later and he has published hundreds of research papers and around 10 books on mind-body medicine. And I call him personally as father of mind-body medicine. But what he says in this book is, when this relaxation technique, which you can learn from any of the previous Bookinar or you can learn it from the YouTube, when this relaxation response, we add the belief system, especially the spiritual belief, then it becomes a much more powerful tool. That is what he has discussed in this book, and he has also discussed in great detail that the body, the senses, what we perceive, is very strongly modified by what the mind perceives. What the senses are seeing or smelling or touching, they are very much modified by how the brain is interpreting it. And he starts this in the first chapter with Lawrence of Arabia, a world famous movie where vivid scenes of thirst and intense heat were shown. And during the film shows, which were done in air-conditioned theaters, a lot of sale occurred for cold drinks, for water, and people felt very thirsty, though the atmosphere was cool. So that's where he starts. And he is giving many good examples of this phenomena, the mind acting on the body. Pseudopsychosis, where the ladies who are not pregnant, they start believing they are pregnant. The mind believes, and the body gets all the changes of pregnancy. And it is very sometimes difficult to differentiate between true pregnancy and this believed pregnancy. Then he adds many good examples for that in his book on the effect of mind and body, where he gives the example of the research of Dr. Roberto Sosa, where the pregnant women during delivery, when they came for delivery, when they were accompanied by a close friend or a relative, the delivery was less complicated and easily done compared to when they came alone. Another interesting study he quotes is from Massachusetts General Hospital. Patients were divided randomly in two groups and blinding was done. Nobody knew which is in which group, and half of them, the control group, were visited by anesthetist before the surgery in a casual way, in a routine way, not casual way, and they were given the information what the patient seeked. The experiment group, they were given a warm personal touch by the anesthetist, giving 2-3 extra minutes, and the results were really surprising. The surgery outcomes were far better in the experimental group, where the anesthetist gave little warmth to the patients. Similarly, another interesting example he quotes, a cargo ship shipwrecked in the New Zealand coast, and a very foul-smelling gas released in that town, New Zealand town. Hundreds of people got admitted to the hospital, though later on it was found the gas was completely harmless. What made them sick? The belief that this is something poisonous. Another research he quotes that was done in downstate medical center at Brooklyn, where the patients of bronchial asthma were made to inhale a liquid, a small fume from a liquid. And they were told that this may aggravate their bronchial asthma problem. And in fact, most of them, they got attacks of bronchial asthma, while it was nothing but normal saline. So, the belief of the patients that we are going to smell something bad for our lungs made it happen. Similarly, he gives lots of example, and then there is a full chapter devoted on how he came to India. He visited the Dharamshala. With the permission of Dalai Lama, he conducted a very strong, very scientific research on the meditation techniques of lamas and how they are able to control the temperature, how they will be able to raise the temperature of the fingers and the toes at least 10 to 20 degree Fahrenheit. They confirmed the results with thorough experimentation. And during that discussion, the Dalai Lama told him that the three most important aspects of Buddhist medicine are the belief of the patient, the belief of the doctor, and the karma or the spiritual force generated by their mutual action. And Herbert Benson very strongly says that this is also what is happening in most of the time, even in the Western medicine, though the doctors underestimate the role of this doctor-patient interaction. He even goes on to say that 75% of people who visit the doctor's office, they get well not because of the drug or the procedures, but because of this, what you call the belief, or you may call it faith factor. And the doctor may further reinforce the belief by increasing the chances of cure, by letting the patient know that he is doing all that medical science can do. If a doctor says, I am doing what can be done by medical science, that itself starts, a better chances of recovery. And he further emphasizes that this doctor-patient trust is not just working through the emotional or psychological well-being. He says there are measurable physiological changes in the body, which he is a scientist, thorough, which he has measured, and he says the physiological changes also occur because of the trust between the patient and the doctor. So, he has, throughout the book, he has emphasized the effect of this mind over the body, and he has also emphasized the importance of the faith, here again the faith. And in the end, he concludes the book by saying that there is a third kind of healing, where the doctor or the healer or the healee, they don't know each other. They are at a far off a distance. The subject of healing in many experiments, he has said, is an animal or a plant or even human beings, and healing occurs. This, he himself says, this is something which the medical science has not explored yet, and he has just ended with that interesting note that this has to be explored. Well, friends, I am happy to tell you that where this book ends, the distance healing, there is a lot of research has happened. A mind-blowing research has happened in this distance healing, and in the future Bookinars, I will be touching on that subject. One of the chief authors who has written extensively on this topic is Larry Dozy, and one of his books, Meaning and Medicine, is one of the classics in this field. So friends,